flying half-mast over Madrid, not for a dead prince or politician, but for ordinary Spanish citizens, the victims of COVID-19, 7,340 and rising. A lone walker in Colón Square. Today, the lockdown was extended for another 2 weeks. Trains have been stilled, and cases are increasing as around the world governments try to work out which measures are too much, or too little, or too late. For many, too much is Hungary, an EU country where today the parliament passed a vote giving Prime Minister Viktor Orbán the right to rule by decree for as long as he chooses.
For all these measures, you are asking an authorization without any time limits, which is unprecedented in Europe.
But Orbán has a huge majority.
We will resolve this crisis without you, even if you do not support this bill.
Video of the Prime Minister aimed to show him as authoritative, but some see his new powers as dictatorial. Under the law, anyone spreading what the government says is false news about COVID-19 can be imprisoned for 5 years. Too little is Belarus, where despite having about 100 known cases, they're still playing professional football, hoping that desperate Manchester United fans may now follow Dynamo Minsk. They're taking their cue from President Lukashenko, who recommends saunas and vodka as a cure. Or maybe Sweden, where primary schools remain open following the advice of senior Swedish epidemiologists who say young children are not major carriers. Swedes are still out and about on the streets, leading some to worry that cases will soon begin to surge. And too late, maybe Russia. Moscow was virtually deserted today as new restrictions came in. Fewer than 2,000 cases have been recorded, but Russia was slow to start testing, and the numbers are now rising fast. The city is quarantined from the rest of the country, but over the weekend, thousands drove out to their dachas in the countryside to avoid the lockdown and could easily have taken the virus with them. And then there are countries that don't seem to know what they're doing. Like India, where none at this Punjab market seemingly noticed Prime Minister Modi's draconian lockdown announced last week with just a few hours' notice. In Delhi, hundreds of thousands of migrant workers have their temperature taken before they leave for their home villages. Is this really preventing the spread of the virus? And how are they going to survive? For some, it's a trek of several days, and they have little to eat.
We're walking because we didn't know what was going to happen or if there would be any transportation available during this chaotic pandemic. My landlord said he won't give us any money or food and asked us to vacate his room and leave. So at 11 p.m. at night, we left.
In one Uttar Pradesh village, healthcare officials doused a group of hapless migrant workers in disinfectant. They had apparently been told to spray buses, but were overzealous. And in Tamil Nadu, they're mixing turmeric and neem leaves for the women to sprinkle around the village. Less of a program of disinfecting and more of a libation to appease whatever gods have seemingly cursed the whole world.
Well, earlier I spoke to the journalist Mandakini Gehlot, who's based in New Delhi, and I began by asking her how the lockdown in India has been affecting people who had little and now have even less.
The situation is fairly dire all along the major thoroughfares of Delhi. There are people who've lined the road, they have nowhere to go. These are migrant workers who generally live where they work, daily wagers, who are paid on a daily basis. And even where I am right now, there are people just sitting by the side of the road, waiting for NGOs or private efforts. Every once in a while, a car drives by with some food and everybody jumps on that car, We've met people now who say they've been hungry for almost 24 hours, some for longer than that. The problem here is that even though the lockdown was announced, arrangements weren't made for the migrant workers. Now, Indian cities, in particular the capital New Delhi, are full of migrant workers. In fact, the economy was built on their backs in recent decades.
And how many miles do you estimate some people are walking, and how many people do you think are affected by this?
It's almost impossible to estimate that at the moment. Just in Delhi alone, the numbers that we've seen are staggering. Yesterday at Delhi's main bus station, reports said that there were about 40 to 50,000 migrant workers waiting for buses to take them home. Of course, there were no buses, even though they were promised earlier in the day. But later in the day, the government decided that the borders should remain closed. People should stay where they are, including migrant workers. The government has set up temporary shelters and food distribution points at various places across the city, about 250 of them. But again, it seems to be that they're just not enough. I've been out since early this morning, so about 10 hours ago, and I've just seen a constant stream of people walking with their children, walking with their bags, asking for food, and it's just really tragic, the kind of scenes that India certainly hasn't seen in many, many decades.
The government has announced a multi-billion-dollar bailout of food and cash. Is any of that reaching the kind of people that you're seeing there?
They're simply overwhelmed. There's just thousands of people who the government, well, I would say millions of people who the government is feeding every single day. But the fact remains there's millions who are left out of that.
And Narendra Modi has said that this lockdown is the only way to fight the virus. Does he have a point that however chaotically it's been handled, this had to happen?
They're very confused by this idea of social distancing. What is social distancing when you live in a tiny room, 7 to 10 people in that room? It's impossible for them to, come up with a situation where they'd be able to leave 1 meter or 2 meters of space between each other. So I think this is a confusing message for people who don't have enough, who live in tiny homes. What is social distancing? How do you practice it when you just don't have food?
Mandakini Gehlot, thank you so much for joining us.
Now, across the world from India, President Trump has extended US social distancing guidelines for the whole of April, citing warnings from public health officials that up to 200,000 Americans could die. Mr. Trump, who had talked of getting the country back to work by Easter, said this morning that the worst that could happen is that you do it too early, and all of a sudden it comes back. Our Washington correspondent Siobhan Kennedy has this.
The aptly named US Navy ship Comfort is guided into New York City Harbor. A majestic entrance as the towering city looks on, but this a grim task. On board 1,000 beds and urgently needed supplies to free up hospitals who say they can't treat non-virus patients because their wards are now overrun by COVID-19.
The number of beds we had at the beginning of March have to triple by May. It is a daunting task, but we got a big, big boost. The arrival of Comfort, this is like adding a whole nother hospital to New York City.
And they need it. On the ground, a forklift truck loads dead bodies onto a refrigerated morgue outside a hospital in Brooklyn.
They're putting bodies in the back of a freezer truck, y'all. Real. My hand is shaking because it's hard to look at this right here, what I'm seeing right now. It's hard to believe this.
These images, one of many being loaded onto social media by astonished onlookers.
Body.
Outside another, the dead are being lined up, waiting to be taken away. Nearly 800 people have died in the city, and across New York State, 61,000 are infected, and the peak is yet to come. As they toiled, Americans woke up to the news that as many as 200,000 people could lose their lives, even with strict containment measures that last night were extended for another 30 days. In the Rose Garden, the man who said the sunshine would miraculously make the virus disappear said the numbers weren't as terrible as the projection of 2.2 million deaths had America done nothing at all.
So you're talking about 2.2 million deaths, 2.2 million people from this. And so if we can hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
So President Trump now believes limiting deaths to something less than 200,000 is doing a good job. And his promise to start opening up parts of the country by Easter?
So that was an aspirational number. I didn't say Easter. I said it would be a great thing if we could do it by Easter. And we know much more now than we knew 2-3 weeks ago. Easter should be the peak number, and it should start coming down, and hopefully very substantially from that point.
Experts had publicly warned the numbers would peak by Easter before Donald Trump envisioned businesses raring to go. The only difference is now, finally, and perhaps to his credit, he's decided to listen. New York doctors like Roshani Raj want him to listen to them too.
And as physicians, you know, we never thought in this country we would be put in a position where we have to really decide who's going to live and who's going to die based on, you know, who's going to get that ventilator.
Is it as bad as that?
In terms of equipment and the personal protective equipment, or PPE, we're already anticipating running out very soon, to the point where we're instructed to reuse masks, things that we normally would exchange for every patient. We're now reusing for several days in a row. So these are not like times that are unlike anything that we've ever seen before.
One doctor echoing the thoughts of many. As the death toll rises, now more than 2,500 victims, families are left to grieve for their loved ones, too scared to open the casket and say one last goodbye for fear of contracting COVID-19.
Well, earlier I spoke to Dr. Nirav Shah from Stanford University's Clinical Excellence Research Center. I started by asking him what he made of the numbers released by the White House that projected between 100,000 and 200,000 deaths in America by the end of this outbreak. Are you able to compare what's happening now with the Spanish flu, for example, or is that just comparing two entirely different diseases?
Well, in some ways it is like the Spanish flu. It's much more virulent than anything we've faced. It's about 10 times more likely to spread than the common flu. And so when we start to bring our mental models of what the flu looks like, oh, the flu is going to go away in the summertime, those things don't hold up. And so perhaps the Spanish flu and other diseases that we don't remember are the best models to use. When you're infecting 5-10 people for every case, compared to a much smaller rate with the flu, the models of the flu don't hold up when it